very much indeed. I can see there are some more people joining. Can you see my slides? Can you see my presentation?
Yes, we can.
Superb. Thank you. My name is Marek. I'm a surgeon. I'm a breast, skin and thyroid surgeon. Today we'll be talking about breast cancer because it's October. October is the month when everybody really wants to talk about cancer and wants to learn about breast cancer. Breast cancer, which is one of the two biggest health problems in Kenya. If you see the slide, you can see that I'm called Oncoplastic surgeon. What does it mean? For many, many years, when we were treating breast cancer, the only way to treat cancer was to remove the breast, to do mastectomy. Now, for at least last 20 years, we know that our patients live very long, 20, even 30 years after cancer diagnosis and cancer treatment. And what is very important is we surgeons, we need to make sure that we perform surgery which is safe from oncological point of view to remove the cancer, but we also perform surgery and we give our patients scars which they are happy with for many, many years after the treatment. And this is something called oncoplastic. Today, I would like to give you a few numbers, a bit of statistics. So, for example, I mentioned already that breast cancer is the most common cancer globally. Up to last few months, lung cancer took over because there are many smoking people, and especially in China, and China has huge population. So lung cancer took over, but still breast cancer is the most common cancer diagnosed in ladies. It's the most common cancer in Kenya diagnosed with ladies. And what also happens with breast cancer is, for some reason, the majority of new cancer cases are diagnosed in low and middle income countries. And you know, Kenya is a middle income country, so it is our problem. Statistics. In 2022, in Kenya, officially, 7,243 new breast cancer cases were registered. It's a big number, but at the same time, unfortunately, I think it's not only me, but we think that it's underestimated. The numbers probably should be closer to 20,000. The problem which we have in Kenya is that many ladies, because it's usually ladies who are diagnosed with cancer, they don't go to see a doctor. Very often they are not even diagnosed with cancer. Out of those 7,200, yes, exactly. Screening is very important, and we'll talk about it, about screening guidelines, and we'll talk about how to improve the things. Out of those 7,243 people diagnosed with cancer, in 2022, 3,398 died because of breast cancer. These are huge numbers, and I will try to stress it during the talk, during our meeting. But every one of us today on this talk, we can improve it. I hope you are here because you want to change something in your life. You can go home today and change someone's life. You can save someone's life by talking about breast cancer and sending them for screening. Very important. In Europe, in America, in developed countries, breast cancer we usually start seeing from the age of 40. Breast cancer in younger ladies happens, but it's not a very common problem. Here in East Africa, here in Kenya, 40%, so almost half of breast cancer patients are very young ladies in their 30s and early 40s. Here in Kenya, we diagnose breast cancer 10 to 15 years earlier than in America and in Europe. We don't know why. If you ask me a question, because probably everybody's thinking why, we don't know. We don't know, is it related to pollution? Is it related to some genetic mutation? Right now, we don't have enough data, but there is a group of researchers trying to answer the question, and hopefully within the next 10, maybe 15 years, we should have some answers. Again, numbers. This is very important. only about 40% of usually ladies, yes, people diagnosed with breast cancer in Kenya, live for longer than 5 years after diagnosis. The numbers are very, very low. Yes, indeed. I can see someone's face, very low. When you compare it to, again, to the Western countries, more than 90% of breast cancer, usually ladies, but breast cancer patients. So there is. Hello, hello. Oops, am I back? I'm sorry. Can you hear me?
Yes, we can hear you. We just lost you a little bit.
Yes, I'm sorry. I'm connected through my phone and someone called me. I'm very, very sorry. Now, we also have another problem. The problem is not only awareness.
Mute. Members, kindly mute.
The problem is also not only the general population, not the awareness within the general public. The problem also, unfortunately, is us medics. There was a study done at Kenyatta KNH, Kenyatta National Hospital, and in that study, the researchers proved that on average in Kenya, a lady with a breast problem needs to meet at least 6 medics. This is doctors, nurses, and some other medical professionals before they are diagnosed with cancer, which means that number one problem is we wait too long with being seen with a breast problem, being seen by a physician, but also very often the physicians maybe don't understand the problem, maybe don't know what to do the problem. Maybe it's because many of those patients, ladies with breast problem, are very young ladies. Facilities. Very often people ask, oh, but do we have facilities in Kenya to be able to diagnose cancer and treat it? Yes, we do. We have private hospitals, we have government hospitals, and the government facilities are improving every year. For example, in 2019, the government bought 91 brand new digital mammograms to improve the breast cancer screening. Every single county hospital, 47 county hospitals, received those brand new mammogram machines. And some of those machines are in other hospitals like Kijabe. Kijabe is a not government organization, but it's a charity organization, faith Christian hospital. And they also received a mammogram from the government. So more and more hospitals in different parts, county hospitals in different parts of Kenya, have more facilities and more possibilities of diagnosing the cancer. We talked about mammograms, we will talk about ultrasound scan, the biopsies is available. There is still a problem with immunohistochemistry. This is something to tell us a bit more about what type of cancer we are dealing with, but hopefully every year it gets better and better. So one of my first slides was about the number of patients diagnosed in 2022, which was more than 7,000. Very often we think that breast cancer happens only to ladies, to women, but it's not true. Gentlemen, please remember that breast cancer may happen to men. I would like to talk a bit more about this slide. This is the moment I would like you to take out your fonts. If you can use, is there a font to call them? Yes, I'm sorry. So you can Google Know Your Lemons. This is the best way, when you see at this slide, this is the best way to talk about potential symptoms, potential signs of breast cancer. You can see the lemons, and the lemons do look a bit like breasts. There are nipples. Can you see the nipples? You can see the skin. And when you ladies look into the mirror, or when you gentlemen look at your wife's breasts, this is what you can see. Now, when you look at here, at this image, there are 12 most common symptoms of breast cancer. You can see the skin, you can see the nipple, you can see the shape, the size of the breast. Now, just to summarize it, the easiest way to talk about breast cancer symptoms would be any change within the breast may mean cancer. Now, what you see in the nipple, what you see in the mirror is a nipple. The nipple can cry. This is the one here, top right of that image. You can see the nipple, and you can see the nipple crying tears or crying blood. Very often it may mean that there is something growing inside the duct causing this problem. You can see that nipple can be pulled by something growing within the ducts. So the nipple sinks in, the nipple goes in. We call it inverted nipple. Sometimes there could be crust, there could be something like an eczema growing on the nipple. Usually it's not itchy, it's just sitting there and doesn't go away. This could be a special type of cancer which we call Paget's disease. We talked about the different shape and different size of the breasts. When you look at the other images, of course, a lump, very common problem is a lump. Many ladies come to see me in the clinic with a lump in their breasts. And gentlemen, please remember, very often my patients say, my husband found a lump and he told me to come and investigate it. So gentlemen, this is your job as well. And any change within the skin sometimes may look a bit thicker, may feel a bit thicker. The skin could be red and hot. There is special type of cancer which is called inflammatory carcinoma. Sometimes the skin, there could be little sores or little lesions. It also can mean that there is something happening. The skin can be pulled in. So basically, this is the message to take home. These are the most common symptoms of breast cancer. Now, very often, I have ladies coming to my clinic with breast pain. Breast pain is a very common problem. 7 out of 10 ladies coming to breast clinic globally, everywhere in the world, come with pain. Now, fortunately, breast pain is not a symptom of breast cancer. Breast pain could be related to hormonal changes. Breast pain could be related to muscular muscle. Pectoralis major, a big muscle the breast is sitting on, being stretched or pulled or be sore. But very rarely pain means cancer. Sometimes I have patients who come to my clinic and they say, oh, I have pain in my left breast, but we find cancer in the right. So then the only answer I can give them is, look, you have someone up there in heaven who's looking after you and someone who told you to have it checked. So this is my message for you. This is the message to take home. Know your lemons. You can Google it and you can load it on your phone and you can talk about the breast cancer symptoms when you talk to your friends, talk to your family, moms, sisters, and hopefully you can save a life today by sending someone for screening. I did mention a bit earlier that breast cancer and cervical cancer are the two biggest burdens for healthcare in Kenya. And it looks like it's not going to get better. The numbers will grow. And according to some statistics, the numbers will grow over 120% over next 20 years. So we need to learn. And that's why I'm so happy. There are 136 people here today at this meeting. We have to learn how to catch it early. I would like us to talk a bit about screening. Screening means looking for a problem before anything happens. And screening is available in Kenya. And the screening is a mammogram. It's October, usually it's October. Every single hospital around us in Nairobi and outside of Nairobi will have some kind of October screening promotion, whatever we call it. They will talk about it. They will offer screening like mammogram at least half price. So for example, in Nairobi, we can do a mammogram now at 2,900 shillings. Very often ultrasound scans are also at half price available. And for example, Shah Hospital has that offer as well. And it includes consultation, it includes ultrasound scan. Unfortunately, today, this month, we cannot offer you a mammogram, but we will be able to offer you this mammogram in a couple of months. There is a brand new machine coming to Kenya, coming to MP Shah, hopefully within the next 2-3 weeks. Now, mammogram is an X-ray. I'll talk about it a bit earlier, but mammogram is the only, the fastest, the most affordable screening tool. Very often cancer can start with tiny little white spots which can be seen on mammogram. We call them microcalcifications. Mammogram, being an X-ray, is the only screening tool which can catch those microcalcifications. So officially, our guidelines, Kenyan guidelines, say we start mammograms at the age of 40. We do screening mammograms once a year up to the age of 55. Now, this is not black and white, because ladies with family history, ladies with a breast problem, ladies with previous cancer, and you know already that 40% of breast cancer patients in Kenya are very young ladies in their 30s. Those ladies can have mammogram done at the age of 35, or let's say from the age of 35, even 32. Younger ladies, we offer ultrasound scan, and very often what happens is we do an ultrasound scan, and if there is anything we need to investigate further after the ultrasound scan, mammogram will be the next step. What is also very, very important is, ladies and gentlemen, you have to be breast aware and you have to know your breasts. So the clinical examination, the self-examination is very, very important. And the recommended age to start is 25. Now, I just need to tell you, not to scare you, but just to give you another number. My youngest patient in Kenya was 22. Youngest lady with breast cancer. It's not very common. It's actually very rare, but it's important to be breast aware even at the younger age, especially if there is any family history. Talking about family history, very often when I speak to my friends, my patients, my people I meet, they say, I don't need to do anything because it's not in my family, so it's not going to happen to me. Breast cancer, unfortunately, very often happens to ladies, to people without any family history. And we have data, we can prove that 11% of breast cancers run in the family. We can prove that there is a gene mutation, we call it BRCA1 or BRCA2. There is another gene called TP3, and then TP23, and then, but only 11% of breast cancer patients carry that gene. The 90%, 89% who come with breast cancer, who are diagnosed with breast cancer, have no family history. So please don't, if anybody tells you it's not in my family, it's not going to happen to me, it's not true. Mammograms, very often there are those myths about mammograms. Oh, mammogram is painful, mammogram is harmful, mammogram will squash your breast and will cause cancer. It's not true. The modern digital mammograms, which are available in Kenya, yes, there is a slight X-ray exposure, but it's very safe. It's not those mammograms which we used to have in 1960s. Many things changed since 1960s. So mammogram is the screening tool, and another message for you to take home is a mammogram can catch cancer before it becomes a lump, and it can catch cancer even 3 years before it becomes cancer. This is a bit complicated slide, but I wanted to put it here because very often I see my patients in the clinic, my patients become friends with time because we meet from the moment we diagnose the cancer, we stay together for at least 5 years. So we have to become friends. And then very often they say, look, you offered me chemo, but my friend didn't have chemo. Why? Because there are at least 10 different types of cancer. And some cancers, which are here, you can see that breast cancer, most of the breast cancers start in the milk duct. So some of those cancers grow inside the duct in the lumen, and we call those cancers luminal cancers. Usually these cancers need hormones and the hormonal treatment because these cancers are hormone related. And these cancers very often are actually most of 85% of cancers, breast cancers, are estrogen, start in the ducts and are estrogen, feed off estrogen. And at the same time, so this cancer we can very often treat with tablets, surgery, radiotherapy. Sometimes we need chemotherapy, but very often, especially if the cancer is caught early, we don't even need chemotherapy. But there are different types of cancer. And for example, you can hopefully see there is a group of cancers, which is in yellow. We call them HER2 positive cancers. These cancers are a bit more aggressive. These cancers need chemotherapy. They require chemotherapy and they require a special treatment, targeted treatment, which is called trastuzumab. It has also another name, Herceptin, for those HER2 positive cancers. There is also another group of cancers which we call triple negative. These cancers do not feed off estrogen, progesterone, they are HER2 negative. So in these cancers, chemotherapy is very, very important. So that's why it's very difficult to compare. Oh, I'm 40, my friend is 40, I had chemo, my friend didn't have chemo, because your friend probably had a different type of cancer. I did talk about diagnostics. In Kenya, we have all the diagnostics tools available, especially in Nairobi. And for those of you who are based in Nairobi, we have a few private hospitals, we have a few government hospitals. And of course, I would like you to come to MP Shah, but my message today is that the diagnostic tools are available in Kenya. What about treatment? Do I, surgeon, can I cure the cancer and do I need anybody else? Yes, I do. Breast cancer has to be treated by a team. Breast cancer, like any other cancer, surgeon on his own or her own is not enough. We have to work, I have to work, I need my radiology colleagues, I need my histopathology colleagues, I need my oncology colleagues, and you know already why. Because surgery on its own, it's not enough. From surgical point of view, we have two options at least. We can remove the breast. And for many, many years, actually in the past, mastectomy was the only way to deal with breast cancer, but not anymore. Now we know that very often, even up to 80% of breast cancer patients can have their breasts saved. And we do breast conserving surgery, but breast conserving surgery always has to be followed by radiotherapy. So here you can see on this slide that there is treatment options, and you can see local treatment options. This is for local control. So what I do, the surgery is for local control, and radiotherapy, which is a type of X-ray, is also for local control, to remove the tissue within the breast to reduce the risk of cancer coming back ever in the future. We have also systemic treatment. Systemic, it's something different. This is about chemotherapy. I'm sure everyone here, and there are already 148 of us today, everybody heard about cancer and chemotherapy. Yes, for many cancers, chemotherapy is very important, and this is the systemic treatment. Me being a surgeon, I can remove the breast, I can remove cancer from the breast, but I cannot remove the cancer or a cancer cell from anywhere else. That's why the chemotherapy is important, the anti-hormonal treatment is very important, and also available in Kenya, targeted therapy. And targeted therapy is Herceptin, the trastuzumab, which I mentioned earlier, and we also have immunotherapy available in Kenya. So what I'm trying to say is that we can catch the cancer early and we can cure it 100%. Very often we can cure breast cancer. This is my message for you to take home. We can catch it early, we have the tools, we can cure it, and we have all the tools to catch breast cancer and treat breast cancer in Kenya. I think there will be just one more slide. This is about removing the breast. So this is mastectomy, but I said that very often I don't need to do it. Sometimes I do. Being a surgeon, sometimes mastectomy is the only way to help the patient, but it becomes less and less a used treatment option. Very often we can remove the cancer and we can keep the breast. And I mentioned it already, up to 80% of my patients can keep their breasts. And there are different surgical techniques. The techniques which we use are the techniques which plastic surgeons use to reduce the breast size. And then we remove the tumor and we do exactly breast reduction and to make sure that from cancer point of view, it's safe and the patient is happy with her scars. And there are many different types of surgical approach. It's just for you to know that there are, in many, many situations, we can save the breast. I think this will be my last slide. When we are talking about surgery, breast cancer surgery, I mentioned surgery to the breast. I mentioned that we can remove the breast or we can very often keep the breast. But what is very important, we surgeons, we also have to assess the lymph nodes. Breast cancer, if it spreads to the lymph nodes. Usually it spreads to the lymph nodes in the armpit first. For many, many years, we surgeons, we used to remove many lymph nodes. Lymph nodes are those green little things on these images. So these are lymph nodes. When you go to see your doctor, the doctor usually says, oh, let me check your glands. Are they swollen? Is there anything happening in your body? Because lymph nodes protect the body from viruses, bacteria, and from cancer and other things. So for many years, we had to remove many lymph nodes. In each armpit, every one of us sitting here has up to 40 lymph nodes in each armpit. For many years, we used to remove 25, even 30. Now we don't have to do it anymore. And it's very important because the surgery in the armpit may cause problems. The lymph nodes are responsible for fluids traveling in the body, and if we surgeons remove the lymph nodes, we can cause swelling of the arm. You probably know, now when you think about it, you will be able to say, oh, I know someone with a big, fat arm. This usually means that this lady, these are ladies, but it can happen to men as well, just like the cancer can happen to men. Because of the surgery in the armpit, they get lymphedema. Lymphedema is that swelling of the arm. Now, sentinel node biopsy allows us surgeons to remove only a few lymph nodes. Sometimes 1, 2, sometimes 3 or 4, rarely more than 4. And this is enough to assess the armpit to get the information for the oncology colleagues, because then they need to understand, is chemotherapy needed, what type of radiotherapy, and so on. So this is improving, and MP Shah is one of the 2 hospitals in Kenya, in East Africa, which can offer this kind of surgery to save patients from lymphedema. This is just to show off. This is that little machine which I have at MP Shah, which I use at MP Shah to localize the sentinel node. And also it helps me localizing the tumor. Okay, I think probably this will be my last slide. This is a mammogram. I think probably very few of you are medics or have anything to do with medicine, but mammogram is an X-ray. Here you can see that it's the same breast. It may look slightly different, but it's only because I squashed it when I was putting it in the slide. This is the same breast. On the left, this is the breast with a lump. Can you see that white blob? This is cancer. This is the lump. This lady came to see me, and because of her type of cancer, she needed chemotherapy. And what we agreed is, because this was HER2 positive cancer, so she had chemotherapy, she had Herceptin, trastuzumab, and after, look what happened, it's the same breast, look what happened to the cancer after chemotherapy. It's gone. Chemotherapy shrunk the cancer to 0. But, you see, chemotherapy is not enough. Sometimes the cancer can shrink to something we call a dormant cancer. And then what happens is that still the surgeons, we have to remove that area where cancer was. And you can see that tiny little white clip. This is what helps me. Again, this clip allows me to use that machine And I can, using the machine in surgical theater, I can find the clip and I can remove the area of cancer, whatever was cancer before. I have a couple of videos how I do it, but maybe I'll stop here. And maybe what we'll do, we'll have time for some questions, for some discussion. I'm sure you would like to ask some questions. Thank you very much. Yes, Grace, I think easiest is you can probably unmute and just, because there is Grace who raised hand and Anne and Mildred. Is it okay? Can we just unmute and ask the questions?
Yes. Yes. Good morning, doctor and everybody. Thank you for this session. I just want to ask one question because lately I've been seeing a lot of, suggestions of alternative ways to manage and to manage cancer, and one of them is the dietary alternatives instead of chemotherapy. And I've also seen a lot of people saying that their patients, or rather their relatives, once they started chemotherapy, that was the beginning of the end. So what would you say to the notion that once chemotherapy begins, then the patient deteriorates quicker than before diagnosis? And secondly, what do you say about dietary alternatives?
Okay, chemotherapy and the patients becoming worse. I think I must have mentioned it. 8 out of 10 patients, breast cancer patients in Kenya, come very late. 8 out of 10. So almost 70–80% of breast cancer, people with breast cancer come to breast clinic very late when the cancer is spread already, when the treatment is very difficult. Now, so this is part of my answer to your question. Now, the other part is, what is very, very important is in Kenya, especially in Nairobi, we have a few certified cancer centers. What is very important is to make sure that the cancer patient ends up in a certified cancer center. When I'm saying certified, it means for different cancers, even for breast cancer, but for different cancers, there could be different types of chemotherapy. Yes, so yes, the patient is already weak. The patient is weak because the patient has metastatic cancer. Usually that kind of patient with metastatic cancer should be given a different kind of chemotherapy. So my answer to you would be, before anybody starts treatment, the patient, the family, you have to ask a question. Was my case, did you discuss my treatment with the multidisciplinary team? Because you may meet a doctor somewhere, I'm not naming any hospitals, any places, and the doctor says, oh, tomorrow you start chemo. But the doctor, every one of us, has to discuss every cancer patient with the team. Yes, because you may be correct. For some cancers, especially metastatic cancers, some of those very aggressive chemotherapies are not the best option. We have other types of chemotherapy which helps us, those other types of chemotherapy help us keeping cancer under control. Sometimes we cannot cure it, but very often we can keep it under control. And when I'm talking about under control, I'm talking about 10, 20, even 30 years. These days, breast cancer we compare to diabetes. These days, breast cancer we compare to high blood pressure. Right now on the call, at one point, I think there were 160 people. And out of those 160 people, I'm sure that there are a few of us who have to take tablets for blood pressure. I'm sure there are a few of us who have diabetes or know someone with diabetes. If we stop the tablets for high blood pressure, or if we stop the treatment for diabetes, this will lead to problems. And it's very similar with cancer, with breast cancer especially. We can keep the cancer under control with some forms of treatment. Sometimes it's some kinds of chemotherapy, but it doesn't have to be that very aggressive chemotherapy which makes the patient much, much weaker. So this is the answer to question number 1. Part 2 of your question, diet. We are what we eat. So yes, diet is very important. For many cancers, if we reduce the intake of, for example, red meat, nyama choma, and so on, then we can reduce the risk of cancer. With breast cancer, it's not exactly like that. Breast cancer very often happens because of the hormones. So it's the hormones, it's usually ladies, it's the female hormones which cause breast cancer. So yes, it's important to eat well. Yes, it's important to make sure that the patient undergoing chemotherapy is feeding properly. Because of course, if the patient doesn't eat enough the chemotherapy, during chemotherapy, very often it's very difficult because chemotherapy may give side effects like nausea and vomiting and diarrhea. So of course, it's those patients, best would be to see a nutritionist who can help with the diet. Is it okay to do diet and nothing else? No, it's not. Unfortunately, it's not. Right now, the only proven way of dealing with many cancers, including many of breast cancers, is unfortunately chemotherapy, radiotherapy, targeted therapy, hormonal therapy, and surgery. Thank you very much. I hope I answered your question.
This is Mildred. Thank you, Dr.
Yes, hello, how are you?
I'm fine. Thank you so much for very insightful information that we received. I saw the lemons that you showed us, and I'm asking, do they almost always, when you see some of those symptoms, is it like it is given that that is clear indication that you may be suffering from or you may be having cancer? One particular one is one that the liquid, like if you're having discharge on your breast.
Thank you very much. This is a very good question.
Is that almost a clear indication that something is wrong or that you have cancer? Number two.
Yes.
Just another one. We do normal, it's not screening, but when you go to the hospital or yearly, maybe you do breast checkup. Is that enough, or you have to go to the real screening at the age of maybe over 50?
So let's start with your second question.
Yes.
If you see an average doctor, someone who sees you first time in your life, or a nurse, or someone who has never seen you before, those people cannot find a lump. Very often they cannot find a lump which is smaller than 2 centimeters. So my answer to you is not, it's not enough. You know your breasts because you ladies, you know them. Your job, your homework is to examine yourself from time to time, once a month, once every 2-3 months. But a doctor you meet once in your life, a nurse or whoever, may not be enough. And we know, we have studies, we have data that someone who doesn't know your breasts may not be able to find a lump which is smaller than 2 centimeters. And 2 centimeters is already a biggish cancer. This is not screening, this is physical examination. Screening is the mammogram. Screening is the tool which we use. Sometimes we have to support it with ultrasound scan. Sometimes we have to support it, let's say, the mammogram with MRI, but examination is not enough. So this is answer to your question number 2. Question number 1, thank you very much. This is a very, very good answer. Those of you ladies who have children, you know that breasts are to feed the children. So the most common discharge from breast is milk. And of course, milk happens during, let's say, the breasts are getting ready to breastfeed during pregnancy, then you breastfeed your children. Then sometimes some ladies still have a bit of milky discharge even after the breastfeeding. If the discharge is milky, if it's from both breasts, of course, it's nothing to worry about. It's annoying because it stains your bra, it makes your nightie not clean, but we are not worried about this kind of discharge. We are worried when the discharge is blood. We are worried when the discharge is from one breast. We are worried when the nipple is crying tears, clear discharge. This is when we are worried, and this is when we have to investigate. I hope I answered your question.
Yes, thank you. You have.
Thank you, Dr. Marek. This is Anne. Thank you for the nice presentation.
Thank you.
In the course of your presentation, you have been talking about hormones, hormonal imbalance, hormonal changes, estrogen, progesterone. So my question is, looking at the current situation in Kenya and the family planning, could it be that maybe hormonal family planning is a predisposing factor to maybe some of these cancers? And number two, I just wanted to inquire also if maybe at Shah, do you have like an annual medical checkup package which includes maybe screening for cancers, and how much can it be? Thank you.
Let me answer question number 2. Yes, we do. The best person is, I'm sure there is someone with us from the wellness clinic. They can give you all the information. We have wellness clinics, wellness packages for ladies. We have wellness packages for men. So yes, it's there. And please, Skitter, maybe you are there, or whoever, please, is there on from NPSHA, please help. And now your second question was about hormones. Yes, it may be one of the risks. I did mention that up to 85% of breast cancers feed off hormones. So yes, your question is very valid, because yes, if a lady is on hormonal contraception for many, many years, I'm not talking about 1, 2, 3, or maybe even 5 years. This is probably safe. But I have patients, I know ladies who were on hormonal contraception for 30 years in their lives. 30, not 3, 30. So you can imagine a young girl at the age of 12 starts the hormones, the hormonal contraception. Then 30 years later, when she's 42, she comes to see me and she says, oh, I want a child. But I'm 42. So what they do, they go for IVF. IVF is another hormonal exposure, because IVF, to boost the hormones, to boost the ovaries to produce eggs, we need to use hormones. And then those ladies, because then they have children, they at the age of 45, they say, oh, but now I feel menopausal, I need HRT, the hormone replacement therapy. And they start HRT. So basically, there are some ladies who are on external hormones for many, many years. And yes, unfortunately, many of them, I'm not saying all of them, because you see, in medicine, I cannot tell you yes, 100% yes. But many of those ladies come back to see me later with breast cancer. So in a way, my answer to you is yes, hormonal contraception, HRT, if it's used for many years, could be related to increased risk. It is actually related to increased risk of breast cancer. Thank you very much.
Thank you so much.
Yeah, thank you, Dr. My name is Patrick from South Sudan. Yeah, I have two questions, and the first question is on behalf of men. You mentioned about they know your what? Know your
lemons.
Know your lemons. Yeah. So as men, we even rarely check our lemon, or sometimes we don't know whether we have breast. And what we know we have is a nipple, and those signs seem to be more applying to the ladies. So how shall we be able to know that we are at risk of getting the cancer concerning men?
Yes.
The second question is for the ladies. I'm also a health personnel. Sometimes they come and they have those lumps, but they are not complete. It's not painful, and they have been with it for some time. So does those lumps later on turn to be cancerous if they are not attended to, though they are not painful? Thank you.
Thank you very much. You said exactly what I said a couple of minutes ago. Breast cancer does not come with pain. Yes. When we look at those 12 most common symptoms, the painful lumps usually are nothing to worry about. You see, painful lumps usually could be some kind of infection, could be cysts which are growing related to hormonal changes. Cancer comes without pain. So we are more worried about lumps which are not painful than lumps which are painful. At the same time, what is very, very important is two things. It is, if there is a lump in a breast, please let's investigate. Any lady older than 25 and has a lump in a breast should have it investigated, please. Out of 10 lumps, only one will be a cancer. So please don't think that a lump is always cancer. It doesn't have to be. But 1 in 10 lumps will be cancer. And this is exactly what you said. We people, we humans are waiting for some fireworks, some, I don't know, some message, text message or an email from God saying, please go and have it tested. It doesn't happen. Very often we wait for those fireworks or we wait for those pain or something. Please don't. Screening means have it checked without any symptoms. I mentioned it earlier. Pain is very common. Pain is very often related to the muscle, to the hormones, to maybe infection. Very rarely pain means cancer, but any lump in a breast which is older than 25 has to be investigated. Now, men. Yes, most common problems, or let's say most common signs, symptoms in men, it's a lump. So there could be a lump just behind the nipple. Trust me, I had one of my patients had a lump for 8 years. His lump was 7 centimeters, and he's still fine. I met him 5 years ago. He had chemo, surgery, and many other things, and he's still okay. But he had a 7 centimeter lump behind the nipple, and he didn't pay attention because he didn't think that it's anything to worry about. Of course, when he came to see me, the cancer has spread to the lungs, to the bones, and to some other areas. So yes, lump needs to be investigated in men, and very common second symptom, or let's say sign of breast cancer in men, is leaking nipple. Yes, again, it could be a bit of blood, it could be a bit of fluid. You see, men don't breastfeed, so we cannot say, oh, this is post-breastfeeding. We have to have it investigated. Thank you very much, and I hope I answered your question.
Yeah.
Hello. Hi, Dr. Marek.
Hello.
Thank you for taking us through the session. It was very, we've learned a lot. My first question would be, you mentioned that women between 40 to 55 years need to take the mammogram, but which tests would you recommend for people below 40 years? And then the other one is, you mentioned that when somebody is diagnosed, the doctor need to advise them if they had a conversation with the multidisciplinary committee.
No, not the doctor. You have to ask the doctor. Did you talk about me, or let's say about anybody with cancer, with the team?
With the team.
Yes. It's our responsibility, but sometimes doctors may be too busy and they will say, oh, I didn't have time. No, you have to find time to talk about me. It's about my life. I'm sorry, I just jumped in.
Oh, okay. So how do you know when somebody has talked about you? Should you be in the meetings for awareness? And lastly is, sorry. Lastly is, we will definitely share on the prevention measures and to our family and friends. And it's sad in Kenya, last is a comment, sad in Kenya that most cancer patients do not make it past 5 years, not even breast cancer only. Most cancer patients barely make it past 5 years after diagnosis. So I hope in the future we can get data on more about that so that we can know how to tackle it. But thank you very much for the session and for your time.
Thank you very much for your questions. You see, I think at one point there were 170 people now today at that meeting, at that talk. 170 of us, maybe more, today can save one life because we can go to our wives, we can go to our sisters. You ladies, you can decide, oh, let me go and have a mammogram. Early detection saves lives, and the only way to improve it is us, you and I, talking about it, talking about the options, talking about the opportunities and what we have, availabilities. And if we don't talk, we don't know. Just earlier today, just before we started this meeting, I had a similar meeting. I'm in Nanyuki, so I'm talking to you from Nanyuki. And I had a similar meeting and I asked the question, is there a mammogram in Nanyuki? And you know what? People didn't know. There is a brand new mammogram in Nanyuki County Hospital, but people didn't even know that there is a mammogram machine. Yes, but hopefully today after my talk earlier with the Nanyuki team, after my talk to you now, we will realize that mammograms are available, widely available in Kenya. Now, not only mammogram, and it's a good question you asked, mammogram is the screening tool. In younger ladies, we start with an ultrasound scan. So let's say if there is family history, or if there was history of cancer, or if there is history of some lumps, not every lump has to be cancer, but some lumps can develop into cancer. Yes, so this is very important as well. And if someone has history of some lumps, we need to investigate and we need to keep them under control. So young ladies between 25, let's say, and 30, 32, we would do an ultrasound scan. But ladies with a problem, ladies with a lump, ladies with a family history, we will start mammograms earlier, 35, even 32. Very often, what is very important, and please don't be upset if a doctor says, oh, you are young, you need a mammogram and ultrasound scan. Very often, we need both mammogram and ultrasound scan. I hope I answered your question. Thank you very much. And when you talk to the doctor or someone with cancer talks to the doctor, the question is, oh, have you discussed my case with the multidisciplinary team? If they didn't, they will become red or whatever. And yes, but they have to tell you very often the multidisciplinary team there is a document. It could be a document online, it could be document in writing, and it could be a document. The doctor will tell you, yes, I discussed it with a surgeon called blah, blah, blah. Or I will say, I discussed it with my oncology colleagues I work with. I discussed it with Dr. Vijay, who's the oncologist. So at least you know that before we discuss, I offer you surgery, I know that the surgery is the best way to treat this cancer. Thank you very much. I hope I answered this question as well.
Hi.
Okay. Hi, Dr.
Hello.
This is Irene. Very lovely conversation. Thank you so much. My question is, I know I've written it on the chat, but we find that people are going probably through chemotherapy and going through radio, and then somewhere along the line, people start telling you, go herbal, do the GNLD, forever living, all these BF Suma, the traditional herbs. What's your take on that? Because sometimes people feel the medicine is either chemo is too expensive, then they move towards these other herbal things. What's your take on that, Dr.
It's a bit similar to what we talked about the diet. Right now, unfortunately for all of us, the only proven treatment for cancers are those official treatment options. So let's repeat, chemotherapy, radiotherapy, in breast cancer, it could be antihormonal tablets, it's the targeted treatment and surgery. Now, I'm not saying please don't do herbal. Very often that herbal medicine may improve the immune system. Yes, so it will not deal with cancer, it will not kill cancer directly, but it may help the body, someone who's undergoing chemotherapy, someone who's undergoing cancer treatment, to become stronger. Yes, so I would never say, please don't go and don't do herbal. It's not true. Herbal could be important just to boost the immune system. Look, what about vitamin C? Even simple vitamin C and D, if we take vitamin C and D, we help our immune system. We need our immune system to be able to deal with cancer. Chemotherapy on its own, it's not enough. Chemotherapy works only in people who want to be cured. You asked the question, so I have to tell you one story. Sometimes, and it happens quite often, I have in my clinic two exactly the same theoretically problems. I have two patients, I have two ladies, one of them is 42 and the other one is 42. They have very similar cancers, but one of them is healing very well, one of them is responding to chemotherapy really well, and the other one is not. But the difference is, when I meet them the first time, I tell one of them, look, it's cancer, but we know how to deal with it. You have your family, you have your friends, you have your support team. I have my team, together we'll fight it. She's happy to fight. But from time to time, I have patients, they come and they say, oh no, my God, I'm dying, I have cancer, I will die. And they don't want to fight. You see, the treatment of cancer is not only what the doctors give you. The treatment of cancer is what you feel, what your family helps you, what your beliefs. Very often people do really well because they believe that God helps them. And it's very important. Yes, it's that belief. There is something in our brains, our bodies, something what boosts the immune system. Without this, chemotherapy on its own, it's a waste of money. And that's why, going back to your question about herbal, I believe that herbal is also very important, yes, because herbal medicine may make you feel more, or let's say someone who has cancer, someone who undergoes chemotherapy, may make them feel more comfortable, may reduce the side effects. If someone is more comfortable, is happier to fight. I don't know if you know anybody who was undergoing chemotherapy or cancer treatment. It's very tiring. It's very tiring because you fight, then you get chemo, then something happens, then cancer comes back. It's like never-ending story. So that help, whether it's herbal treatment, whether it's what is very important is also very important to be with the people. I didn't mention today Faraja. We are very lucky in Kenya. We have a place called Faraja. Faraja was set up many years ago by a lady who had breast cancer. And because of her experience, she wanted to give something back. And she started that Faraja Cancer Support Group, Cancer Support group, yes. And at Faraja, patients with cancer, newly diagnosed or cancers after treatment, they can meet, they can talk about things, they can ask each other, how did you deal with this problem? How did you overcome this sickness or that something else? So yes, unfortunately, chemotherapy and the official treatments are very important. These are the only proven ways of dealing with cancer. But yes, herbal and everything else is also very important, but together, not instead. Thank you.
Dr. Marek, I have two questions. I hope I'm audible.
Yes, we can hear you, Bessie.
Okay. So my first question is how far down the family history do you need to go to check if the family is exposed to cancer? Should I check just my mother and her mother, and or should I check my mother's siblings as well?
Very good question. Thank you so much. If I may, let me just answer quickly. So yes, we are talking about family. It's not only mother and sister. It's mothers, sisters, brothers, aunties, grandparents. It could be someone's sister. Yes, because if there is any gene mutation, the gene may skip a generation. So for example, grandmother may have the gene and grandmother could have had ovarian cancer, or grandfather could have had prostate cancer, or an uncle could have had pancreatic cancer, but because it's within the family, all those cancers could be related to one gene mutation. Sometimes the grandma has, the auntie has, but the mother doesn't have it. Yes, because the gene just skipped one generation. So yes, it's important to ask questions not only about the very core of the family, it's important to ask questions about the extended family. Next question, Bessie.
Yeah. So I wanted to know for the monthly self check that we should do as women, at what point in a woman's cycle is the ideal time to do this check?
Again, thank you. Your question is spot question. So basically what happens is, you ladies, you know your breasts. You know that just before your ovulation, the breasts become a bit swollen, a bit tender, a bit annoyed. You know really well that just before your period, your breasts again become tender, swollen, uncomfortable, painful, whatever you call it. This is not the time to have your self-examination. This is not the time to go for the mammogram. Because if you go for a mammogram when your breasts are already swollen, you will hate the mammogram. The best time to examine yourself, the best time to have the mammogram, the ultrasound scan, is usually about a week from the first day of bleeding. The easiest way to answer your question is, ladies, you know your breasts. You know how your breasts behave just before your period, and you know when your breasts go, they become softer, they become normal. Usually it's about a week after the first day of bleeding, but it could be 5 days, it could be 8 days. Everyone is slightly different. But yes, thank you for this question. I don't think I stressed this enough, and this is very, very important. Thank you so much.
Thank you also.
Daktari, I also wanted to ask, you mentioned about the nodes. So if everything is okay and then the mammogram picks maybe some axillary nodes, is that something to really worry about and go back for an ultrasound scan? So what do you say about the axillary nodes? Or do they appear sometimes when you're exercising, or do they become...
Great question again. Thank you so much. Lymph nodes, in everybody, we have actually many lymph nodes. The lymph nodes are protecting the body, and they from the viruses, from the bacteria, from cancer, and many other things. We have lymph nodes on our neck, we have lymph nodes in the breast, we have lymph nodes in the armpits, we have lymph nodes in the groins, we have lymph nodes everywhere. The lymphatic system is everywhere in the body. Now, lymph nodes and large lymph nodes are a very common problem, especially in ladies. Why? Because you ladies, sometimes you do funny things to your armpits. Maybe you shave your armpits, maybe you wax your armpits, but doing this, you annoy the lymph nodes. So very often, ladies will have slightly swollen lymph nodes. You ladies, you go home from work and you do cooking, baking, chopping your vegetables, you cut. Very often I go home and I can see my wife has a little cut on her finger. She has a little burn because she was baking something. Because of all those little injuries, the lymph nodes in the armpit will be a bit swollen. Very often they could be not only swollen, they could be even painful, tender. The armpit may be painful. So slightly enlarged lymph nodes usually don't mean anything to worry about. But at the same time, it does happen that there is cancer in the breast. The body manages to deal with the cancer in the breast, so mammogram is completely clear, but the cancer already spread to the lymph nodes. So yes, my answer to you would be, please don't panic if there is a lymph node on a mammogram, but an ultrasound scan is always the best way to prove that it's nothing to worry about. Did I answer your question?
Hi, Dr.
Yes,
Mariusz.
Doctor. Yes. Thank you so much. Thank you very much.
Thank you.
Yeah, thank you for the presentation. I have 2 questions. So you said hormones are a predisposing factor to breast cancer. Which one in particular? And then number 2, there are conditions which are currently being managed by hormonal treatment. Is that a risk? And what would be your advice to patients who are on prolonged use of hormonal drugs? Thank you.
Okay. So this is usually, the hormones are usually recommended by the gynecologists. Now, you have to ask your gynecologist what you are on, and usually the doctors, the gynecologists I work with, usually they say, look, we are planning a hormonal treatment for you. You are at that age that we have to make sure that it's safe to give you the hormones. So usually before we start any HRT or any hormonal treatment, we do screening. So, for example, if we are talking about a young lady who's 19 or 20, she's given some hormonal treatments to regulate her periods, usually we just keep an eye on it. Or we do an ultrasound scan to make sure that we know what the breasts look like before we start the hormones. If someone is 35 or 32 with family history, or 40 and starts hormones, again, usually we would have to. So if your gynecologist forgot, I mentioned it already, we doctors, sometimes we may be busy and sometimes we may just simply forget about some things. But if your doctor gave you some hormones and forgot about screening the breast, please have your mammogram and an ultrasound scan. Because you know it already, we talked about it, hormones increase the risk of breast cancer, and it could be estrogen and progesterone, because breast cancer may feed on both of them. And you see, sometimes we need to balance the benefits and the risks. If the hormones are helping with some other problems and the breasts are fine, we keep monitoring the breasts. Yes, because usually it's not like you have to be on the hormones for 30 years. Yes, it's not good. But if one needs hormones for a year or 2, We just monitor the breast to make sure that everything is fine. And the way to monitor is the screening, is the mammogram, ultrasound scan, sometimes in very young ladies, dense breasts. I'm talking about those ladies in their 30s. It could be an MRI breast as well. Did I answer the question?
Yes, thank you.
Skitter, I think now we can talk about the wellness packages.
Hello, Dr. I have one question before you go to. Now, I was asking about the dressing. Like sometimes you hear people saying when you are putting on a bra that has some metal, it can really affect somebody. It can cause cancer. I don't know whether it's a myth or it is true. And again, when you are over 55, you should be relaxed that nothing will happen, or there are some cases of people who are over 55 who can get that cancer. Thank you.
Thank you very much. Again, your team is brilliant because your questions are very, very spot on, very important questions. Bra doesn't cause cancer. It's a myth. Breast, let's say bra, especially ill-fitted bra with wires, underwired bra, ill-fitted definitely will give you pain. Yes, because there are some nerves on the side of the breast, and if the bra is ill-fitted, it will be poking some of those nerves. So many ladies come back to the clinic, and as soon as we discuss the bra, they take the bra off, remove the wire, pain goes away. Now, breast cancer doesn't stop at the age of 55. When I was in Europe, before I came back to Kenya, most of my patients in the UK, for example, were ladies in their 80s and 90s. Because breast cancer, risk of developing breast cancer grows with age. So the screening is once a year from the age of 40, official screening, yes, it could be from the age of 35 actually, to the 55 once a year, because this is when the breasts are dense. This is the time when cancers, if they grow, usually they grow fast. So we need to check the breasts every year. After the age of 56, mammogram is still very important because mammogram can catch cancer, but we don't do it every year, we do it every 2 years. In England, for example, we do it every 3 years. But in England, in the UK, everything is paid with public money. You probably know that in the UK there is NHS, and NHS pays for everything. There are private hospitals and private doctors and private options, but screening is done always, almost always paid by NHS. But because there isn't enough money in the system, NHS pays for screening only every 3 years. In continental Europe, we do it every 2 years, and the guidelines here in Kenya, from the age of 56, we still do mammograms, please don't stop, but we don't do it every year, we do it every 2 years. Did I answer your question?
Thank you. Thank you. Yes.
Thank you very much. Skitter, are you there?
Good morning. Yes, I'm here. My name is Kita from MP Shah Hospital. Just to answer the question on packages, both for the breast cancer screening for this month of October and wellness, we do have a very subsidized package that is running throughout this month of October. You can access these services either at our main branch here in Parklands. That should be Monday to Saturday. We are doing it on a booking basis so that you can get the best experience. So I have attached a copy of the package in the chat so you can have a look at it, and also maybe you can capture our number for booking. The number would be 011 000 600. Okay. The number would be 011 000 600. So you'll find that this package is it's at half price. We have a combination of breast ultrasound and pap smear, and also breast specialist consultation. So it is all discounted. So at the main branch, the services are available from Monday to Saturday. But at our village market, the service is extending even up to Sunday. So it is Monday to Sunday. Then apart from the checkups for the breast cancer during this month, we also have our wellness packages. And our wellness packages are quite vast, and they are very intense, and they depend. We have wellness packages for the ladies and also for the men, and it goes per category. We also have a wellness package for women at 40 years, and as well we have an executive package, and as well as we have a cardiac wellness package. I can attach a soft copy of the same at the on the chart, and you can have a look at it. If you would be interested in getting wellness as well, the same number, you'll use it for booking. Our wellness package starts as low at low amounts, starting from 13,500 for the women, for the men starting at 10,500, and depending on the level of wellness that you have. Our executive wellness is at premium wellness is at 65,000. That is for the woman, and for the man is at 60,000. So I'll attach a soft copy of the same for the wellness, and you can have a look at it in the chat. So thank you. Back to you, Doc.
If I may add, ladies, for you, what is very important is that package with ultrasound scan, mammogram, more important even mammogram, and pap smear, please. Yes, because today we were talking about breast cancer, but the second biggest killer of ladies in Kenya is cervical cancer. So whichever package you will ever choose, just make sure that you check your breasts and your cervix. There is also a package, Skita mentioned it, for men. And you see, the problem with men is that screening for prostate cancer is not that easy. Screening for breast and screening for cervix is well established. We know that screening saves lives. With prostate, unfortunately, there are too many things happening. And yes, people say do PSA. And you can do the PSA, but PSA is 50-50. Sometimes the PSA could be raised, and it's only because of some kind of inflammation. And you can imagine a man getting a result saying, no, your PSA is very high. And then after many tests, it just shows that, oh, sorry, but it was only an infection. So that's why it's not that easy. I'm really sorry, gentlemen. In our case, we have to work on it a bit more. But one day, if you'd like to, we can talk about prostate cancer more, because the way breast cancer is the most common cancer in women, cervical cancer second most common, the prostate is the most common cancer in men. Thank you very much.
Okay, thank you very much, Dr. Marek, for the very informative session. I believe that all members have learned, and the questions have been well addressed. And I believe that you're going to send the presentation so that I can share with the members. Kindly confirm if you are going to share. Dr. Marek, are you there?
Yes, I'm sorry.
Are you going to share the presentation?
Oh, if you'd like to, yes, of course. I can send it to Skita and then she will share it. Of course.
Okay, I've seen so many people asking about the presentation in the chat box, so I'll share before close of business today. And thank you very much. Okay, we'll have you again, I think, next month for the prostate cancer, second week.
Thank you very much.
I'll be sharing the link.
If I may just say thank you. Thank you for joining. It's very important for me because I came back to Kenya in 2019. And since 2019, together with MP Shah team, we are spreading the awareness because that's the only way to reduce the breast cancer casualties, which unfortunately are very common in Kenya. So thank you very much. Thank you for great questions. Your questions were really to the spot, excellent. And there were 160, 170 people. So all of us today, we can save many lives. Asante sana.
Thank you very much. And members, now you can leave.
Thank you for a very informative session.
Thank you for the attendance.